why is there a heart center for women? Our mission is to improve heart care for women. I think the other question is, why do we need to improve heart care? Well, heart disease is the #1 killer of women, and much of our care model is based on research done primarily in men. And women are not men. There are important differences that need to be considered. Firstly, our biological differences. Every cell in our body has a sex, and that affects how we manifest disease, how we feel with disease, and how we respond to treatment. It helps explain why women are more likely than men to develop microvascular disease or spontaneous coronary artery dissection, why we have different symptoms when we have a heart attack. And then there's the profound difference of women have pregnancy and menopause. These transformations affect our hearts, and it affects our whole cardiovascular system. The other differences to consider are the social and cultural differences. Women experience the healthcare system in a different way. Woman is the caregiver of her family, and she'll often put her own health on the back burner in order to care for others. She's less likely to participate in cardiac rehab, for instance, following a heart attack or open heart surgery because of her caregiving duties. Also, a woman's experience in the emergency room can be akin to her experience in the boardroom, where she's dismissed or talked over, and then a diagnosis is not made or missed. Lastly, policy and research has had a big impact on women's heart health. First of all, women of childbearing age couldn't be included in drug trials for decades. It wasn't until the 1990s that it was mandated women be included in trials at all. So we're decades behind with many questions left unanswered, including what causes spontaneous coronary artery dissection, or how do we treat microvascular disease? We know that menopause increases our risk of heart disease, but why doesn't replacing estrogen fix that deficit? Understanding these differences and how they affect a woman's heart health are the cornerstone of care at the Heart Center for Women. We're here to improve heart care for women.